Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela. On this program, we explore health issues that are prevalent in the White Mountains, and we try to develop an understanding for these issues and utilize our local resources available to address our problems. Our guests are drawn from the local experts that are in the trenches and have our local perspective. Today's guest is Dr. Corey Kennedy, a naturopathic physician, currently practice in Show Low, and a member of the Summit Healthcare Physicians. I would say welcome, Dr. Kennedy.
Thank you. It's great to be here.
I hope it is great to be here today. And so you're a naturopathic physician. You've been in practice up here for 8 years, so you were telling me?
Yep.
And in those 8 years, my understanding is that you have an incredibly successful practice.
I'm very blessed. I have an amazing practice up here.
You have an amazing practice.
Yeah.
And, you know, naturopathic medicine is probably foreign to most people, don't understand it very well. We understand the word natural.
Right.
And you're a naturopathic physician. So let's start off a little bit and find out what your training is as a physician and the naturopathic approach.
Yeah. So as a naturopathic physician, we're basically trained like primary care physicians. So the same basic medical sciences that an MD or a DO would go through. So we have the first 2 years is clinical, medical, basic medical sciences, and then we have 2 years of clinical sciences with hands-on training. In addition to conventional medicine, though, we're trained in natural and alternative modalities. So we spend time learning herbal medicine and nutrition and physical medicine, acupuncture, and Chinese medicine. And so as a naturopathic physician, we have a lot of tools in our toolbox to really customize our treatment plans and meet the patient where they're at.
So it looks like the start of your education, at least the 2 years of basic sciences and then the 2 years of clinical, is identical to allopathic physicians. And then
very similar.
And then the dispersion happens right after those first 4 years.
Yeah.
Where I, for example, went into pediatrics and another person might have gone into surgery.
Yeah.
You went and did the naturopathic approach.
Yeah.
Do you really have all of those tools in your armamentarium?
I certainly do. You know, I felt very proficient in all of those areas kind of graduating. But once you get into clinical practice, you really have to decide what works and what feels the best, I think, as a practitioner. And so I don't necessarily practice acupuncture in the clinic up here, but I recommend it to patients when it's appropriate. My specialty or my preferences for implementing natural medicine really kind of focus around functional medicine. And that's a term that we're hearing more and more, but yet I still think there's a lot of confusion, very much like naturopathic medicine, as far as what is that and what does it really have to offer patients. Functional medicine is really a treatment approach, a philosophy that deals with custom approaches to medicine, to very complex chronic diseases that we generally see with the aging process. And so some of the guiding principles with functional medicine is that we're really looking for the underlying cause of that disease and correcting those imbalances versus just using a prescription kind of as a Band-Aid on the situation. So when we look at kind of the rates of diabetes and heart disease and autoimmune diseases, you know, we're seeing more and more of a prevalence with this, and acute care medicine doesn't have necessarily all the solutions or maybe the best options for patients who are struggling with those conditions.
So what I'm gathering is that you function on the whole person as a continuum. Well, one of the approaches, at least, of allopathic medicine in adults, probably more so than in children, is to treat individual diseases rather than the long-term process that leads up to potential diseases. Right. I know in children, at least pediatricians, the well care and continuum of development is a large part of at least the pediatric portion of practice.
Right.
But a lot of adults once they get past teenagers, do
Right.
not focus.
Right. There's not a whole lot of talk about good nutrition, exercise, supplementation, things like this to really optimize our genetic potential. You know, where functional medicine is looking at genetics and epigenetics and biochemistry and how we can offset any type of genetic mutations that are affecting these patients on an individual level. So it's a very custom approach.
And we're beginning to see that genetics is a very important part. You know, the first thing that a doctor asks you when you go into their office as a new patient is, what diseases did your parents have?
Right, exactly. And as we learn more about genetics and even more about epigenetics, it really gives us a potential to intervene much earlier in that disease process. So when we look
define
at
epigenetics a little bit?
Sure. So
at least for our listeners and for me too.
yeah. So epigenetics is kind of a newer branch, and when we look at genetics, we have our DNA, we have what mom and dad and God gave us, you know. And for a lot of years, we always thought that, you know, if mom had heart disease or dad had heart disease or diabetes, then it was just a matter of time. It was inevitable. Epigenetics is really looking at how we're changing genetic expression based on environment, based on nutritional factors.
You know, there's one saying, at least in medicine, is that anybody can make a family history. And maybe that's the evolution of epigenetics. Is that a proper statement? That, you know, you are changing, are continually changing, so you don't necessarily have to have what your parents have?
Yeah, I think a common saying is that genetics loads the gun, but diet and lifestyle pulls the trigger. And so what we see with these patients is that by changing diet, by adding natural anti-inflammatories, we're able to turn down the genes that cause aging and disease and inflammation.
Is that like changing the natural progression through natural approaches?
You know, I think it is. I think that there's a lot that we need to explore and a lot that we need to study in that regard. But it's really fascinating to me every day when I see patients walking in, and the majority of my patients have heart disease at some level. They're diabetic or pre-diabetic. Their joints are aching. They probably have a little bit of weight to lose, and they're very overwhelmed by all of these different issues that they see their bodies kind of decompensating with this aging process. And they go to their primary care doctor who is doing a great job of managing those medications, but at the same time, the patients are wanting to know what their other options are. They want to become an active participant in their healthcare. They want to prevent something. You know, so many patients are walking in the door and they're saying, gosh, Dr. Kennedy, you know, I'm taking care of my mom. She's got Alzheimer's disease. You know, I'm seeing my body type and I'm seeing my behaviors and I'm just like my mom. What can I do to prevent this?
And you've really just described the three biggest issues of aging. You know, the brain in terms
Right.
of Alzheimer's disease, the heart in terms of everything that we do, and joints, which show the things of time.
Yeah.
Now, you describe this as aging well or wellness aging?
I think that, you know, wellness aging is really kind of an approach to healthcare. And aging well is what I want my patients to do. You know, whether they're in their 60s or 70s or 80s, I want them to walk in and say, Dr. Kennedy, I feel great. My energy's great, my mood's great, my sleep's great, my digestion's great. You know, I may have a little bit of joint pain, but it's way better than what it used to be. You know, I want them to engage in life. And not so long ago, you know, when we look at kind of that typical lifespan, people worked really hard for a lot of years at the same company, and then they retired and they got a gold watch, and maybe they went on that trip to Europe, or maybe they sat in a rocking chair for a couple of years, but the golden years were not that golden, and then they, you know, crossed over, and with the baby boomer generation, things have really changed. And so we're seeing patients, elderly patients, who are riding bikes. They're taking yoga classes. They're learning new languages. They're traveling. They're not necessarily content with retiring and letting that be the end of their story.
Yeah, well, as a retired physician, I can tell you that I hope that doesn't happen. But let's talk a little bit about, you've given 3 areas. Mm-hmm. So how does a naturopath approach the head issue? How would you, if I came to see you as an old patient, mm-hmm. which I am, mm-hmm. And I want to maintain my healthy brain.
Right.
What would you do or tell me as a naturopathic approach?
There are some very basic foundational issues that I want my patients to all have. And so when we look at kind of that hierarchy of treatment options, lifestyle is the bottom of that pyramid. So I want them eating the right foods, and I want them exercising. We want good blood pressure control. We want good blood sugar control. So, as we look at more and more information that we're gleaning from diabetes and blood sugar control, we know that the lining of the arteries can become sticky almost from too much sugar. That causes damage to the small arteries in the brain. And if we're not getting blood flow, we're not getting nutrients, we're not getting the good stuff in and the cell byproducts, the junk out, we're going to have a lot of issues with cognition. The other thing that functional medicine really looks at, and I think that's very different from conventional medicine, is kind of the effect of the environment on the body. We have more and more toxins and chemicals that are being dumped into the environment. We're breathing it in. It's in our food. It's in the water, and those chemicals are building up, and they're causing issues with memory, with insomnia, with mood. And so functional medicine really is looking at evaluating that and helping to rid the body of those toxins so that the cells can function better. And so diet, lifestyle, but really making sure that we've got inflammation under control.
Inflammation. Now, inflammation is a big part of joint disease.
Inflammation is, the way that I describe it is it's kind of the spark that starts the fire, but it's got this cascade that kind of echoes throughout and keeps throwing gas on fire. And the inflammatory cells are not just in one particular location or one particular system. And so we're learning more and more right now about GI health and gut health and all the beneficial bacteria that are in our digestional tract, and it's now being referred to as the microbiome. So we have more bacteria in our gut than we have cells in our body, and we can trace back a lot of these diseases associated with aging to gut health.
Really?
So even just helping with digestion and straightening out that dysbiosis in patients, right there, we're going to calm down some of that inflammation.
So are probiotics, a part of your regime?
Definitely.
I know that's been a big issue for maybe the last 10 years or so.
Yeah.
In terms of treating things like diarrhea.
Yeah. But it goes way above and beyond that. And so we know, for instance, that Lactobacillus acidophilus, which is a type of good bacteria in your gut, is associated with GABA levels in the brain. So patients who
GABA
have...
is a neurotransmitter
GABA is
in the brain
a neurotransmitter.
that helps your brain work better.
Yeah,
Okay.
So GABA is kind of our main inhibitory neurotransmitter. So it calms us down, it helps us manage stress and anxiety, it helps with sleep, all of those things. And so there's such an intimate connection that we're learning about now with gut health and brain health that for most people, we've got to start with treating that inflammation in the gut before we can gain ground systemically.
Wow. Acidophilus. Mm-hmm. So that means I should go to the store and buy acidophilus milk? I mean, I don't know. I mean, how do you approach that? If I come into you,
Yeah.
you know, and I say, you know, I got a lot of stomach pain. I may have diarrhea, or I may be constipated.
Yeah.
I mean, I may have. Do you think, well, you know, you need to get your gut in balance, and then
Right.
you approach that?
Right. So generally, you know, we're gonna pull out foods that tend to cause a lot of inflammation, and we're definitely going to repopulate that gut with good beneficial bacteria. So we can certainly get those probiotics through food, whether it's yogurt or it's fermented foods. And I think that's a good part of the lifestyle. But for patients who have kind of gone beyond that, their symptoms are way more severe. We really need to use more therapeutic levels of probiotics. And so that's when we're going to prescribe a particular strain or a particular concentration so that we can see those improvements.
And that might be different from, you know, an allopathic physician or a GI physician who uses medicines like Lamodal or Miralax for constipation, you know, and some other agents like for constipating to treat diarrhea.
Yeah.
I know that's a big thing. I didn't realize that was a big part of your approach for that.
Yeah.
Now, I want to also talk about the third area that you talked about, because you work with Dr. Memnon, who is one of our cardiologists up here in Sholo, and he uses your approach in cardiac rehab.
Yeah.
So tell us a little bit about heart health, and then I'm going to finish with a favorite area of mine, and I hope of yours. But talk a little bit about your approach to heart rehab, which is a big part of that, because people have heart attacks and high blood pressure for mostly improper habits, I would think, and poor wellness.
Right, exactly. A lot of cardiac disease can be prevented or better managed through lifestyle medicine. So, you know, it was really interesting. I got offered a residency position after graduation, and I opted to train with Dr. Memnon instead. And so I spent my last year of medical school training with him, and it started with my love of cardiology, quite honestly, but what we realized kind of throughout that preceptorship or that training is that we worked very well together. As far as cardiac patients, you know, a lot of them have weight to lose and they need the better blood sugar control. And as a cardiologist, he doesn't have time to really delve into the depths of that for patients. You know, his belief is that, you know, he doesn't just want to deal with that acute heart attack and then send the patient on their way. He really wants them to have the knowledge and the power to make those lifestyle changes so they don't end up back in the cath lab 6 months or 18 months down the road. And so it was kind of a training ground for both of us really at that point. And so there's certainly nutritional products that we use around cardiac care, CoQ10 and fish oil and magnesium and things like that. And that's all well and good. You know, those have a lot to offer. But if we don't deal with the complete diet and the exercise and helping these patients recover from heart attacks and make those changes so that they don't end up back there, then it's really kind of just, we're setting them up to fail. To fail again. And that's another visit to the cath lab. Yeah. And stents and all the things that he does that we would like to. And he does brilliantly. And it's great that we have him up here to be able to provide that service. But at the same time, you know, if that was your brother or your mother or whoever it may be, you don't necessarily want to see them in that situation again. You'd like to see them be healthier. So it sounds like what we've talked about, people with chronic stomach problems, bowel problems. You talked a lot about overweight, and that, of course, is a high risk for diabetes. You talked a lot about heart disease and prevention of heart disease. So it sounds to me like when a patient comes to see you, they really get a full body look. They do. Rather than just the heart, just the stomach. I'd like to prevent Alzheimer's disease, although a lot of people say that I'm getting it.
But the bottom line is your approach is more than a single system approach.
Right.
Different than the heart.
It has to be.
Okay.
If
And
we wanna
so
get well.
your prescriptions are wider. Now, I know you use a lot of natural approach things like that. And, you know, we don't hear as a public much about natural approaches to medicines. We hear lots of advertising on TV for
Right.
drugs.
Right.
And that is not your approach.
Here in the state of Arizona, we, as naturopaths, we have prescription rights. And so there are certainly situations where I do write prescriptions, but my hope and my goal is to not only try natural approaches first and see if that will get them to goal, or if we use a medication, it's really just short term, whether it may be a statin medication to control their cholesterol or a high blood pressure medication. I want to get them good and stable while we're implementing the lifestyle changes so that we can eventually get them off those medications.
You know, and I know we had a previous conversation before we had this interview here. And you don't see a lot of advertising for natural medications. And we had that discussion that there's not a lot of money for pharmaceutical companies' patents for natural medicines. And that maybe is the reason why we don't hear about this wonderful approach as often as we do.
Right.
Now, you also do something up here, I know, because people tell me from a naturopathic standpoint, in terms of doing bioidentical hormone treatments.
Right.
And this is a big issue, especially for aging women and men.
Right.
And men. So talk a little bit about how your approach, and I know you love bioidentical hormones.
I do.
And stuff. So tell me a little bit how you approach it in women's issues.
Okay. So when we look at hormone replacement therapy, or HRT, you know, it first came into being for women who had the most severe symptoms of menopause, hot flashes and night sweats and mood swings that were really interfering with their quality of life. But it was really indicated that patients were going to be put on hormone replacement short term. But they felt so much better on it that they were put on and left on hormones for a lot of years. And then we had research that came out that said, oh, well, synthetic estrogen in conjunction with synthetic progestin looks like it causes an increased risk of heart attack and stroke. And
now, those two chemicals, estrogen and progesterone, are a common ingredients in birth control pills?
Birth control pills and hormone replacement for women.
Okay.
So, but the interesting thing that I think causes a lot of confusion is the term progesterone versus progestin, and Premarin and things like this, is that the biochemical structure is not identical to what we would see in the human body. And so in order to make that medication and patent that medication, they alter the structure a little bit. And that's what makes it unique, but that's what also makes it patentable. And so I describe it to patients as, you know, it's kind of like trying to fit a key into a lock that's not quite right. Now, there are some women that are on synthetic hormones that do fine, that do great with them, but not all women do. And so I think it's wonderful that we have options now with bioidentical hormones. And even though we think of it as being more of a new technology or a new therapy, it's been in the US for 20 plus years. You know, it's just now becoming a little bit more prevalent or a little bit more mainstream. There's always a lot of fear and concern about cancer and heart disease when we're talking hormone replacement, and we've got research coming out of Europe where women have been on it for 20 plus years, and there's no increased risk of breast cancer and there's no increased risk of heart disease. And so I certainly think that bioidentical hormone replacement can be a great option for a lot of patients as long as it's implemented appropriately.
Okay, and so bioidentic hormones for women would be just pure estrogen?
My preference is really to give more of a comprehensive hormone balance. And so in conventional medicine, if a woman has had a hysterectomy, they're just going to replace estrogen. But we have progesterone receptors all over the body as well. So unopposed estrogen we know causes weight gain. We know that it can affect the breast tissue, where when we give these things more in a balanced approach, we don't necessarily see the side effects from that.
You mean the weight gain? And women like to not gain weight?
We do not want to gain weight, and that's a common issue in menopause. It's very interesting to me because when you look at the research, they say, no, women don't gain weight, they just store fat differently. Well, if you start storing fat around your abdomen, many people are going to perceive that as weight gain, and it's not a fun process to go through. So not only that, it's not just about aesthetics, but it's really about, again, body composition. And we know that fat is an inflammatory tissue. It sends out inflammatory mediators to every single cell in the body. And so not only do I want them feeling great, but, we want to look great as well.
We always do.
We do.
Men too.
Right?
Men too,
yeah,
and
for
stuff
sure.
like that. And of course, preventing the overweight issue also helps prevent late onset diabetes in women. Not
that has necessarily been studied with bioidenticals, but it'll be interesting to see, where we go with this.
Now I would ask you, is there any true data to show that using a bioidentical estrogen decreases the risk of eventual development of female organ cancers?
I don't think we have any of that data yet.
Okay.
Well, hopefully we'll have that soon.
One of the neat things about medicine is that you always read about ongoing research for something. Yeah. And I know targeting research is it. Yeah. So can you talk a little bit about us guys, old guys, medicine and bioidentical hormone replacements? I
do a lot of testosterone replacement as well. And, another kind of curious phenomenon that I'm seeing in my practice is I have younger guys in their 30s that are coming in and their testosterone level is lower than some of the male patients that are in their 60s and 70s. So on one hand, we're seeing some of those endocrine dysfunction issues from environmental toxins with younger patients, but as men age, testosterone levels can go down as well. And so testosterone for men is not just about libido, quite frankly. It's about energy, it's about motivation, it's about mood, it's about maintaining cognition and bone health and muscle
same as
health.
In women,
the same thing. And so what I love about hormone replacement, whether it's male or female, is that when hormones are balanced, patients come in and they feel great.
Now, bioidentical hormones are paid for by insurance companies, since most of the old people are on Medicare?
Generally not.
Okay.
Generally not.
And the cost of them is about?
So we're looking normally around $50 a month for a prescription. Sometimes that prescription will last 2 months. It kind of really depends on the patient.
So it's not that expensive when you consider the other costs of drugs, especially from our old people.
Yeah, I mean, if they're not taking medication to help them sleep or an antidepressant or something for pain, if we're not having to consume all those medicines.
Okay. Well, we're going to have to stop here. I thank you very, very much for your comments, and I know you're quite compassionate when your patients come in to see you, and thank you very much.
It's my pleasure. Thank you.
I would thank you very much for joining us today on Discover Health, and thank you for our wonderful guest, Dr. Corey Kennedy, a naturopathic physician here in Show Low. Thank you.